Africa are expected to run out of ready-to-use emergency food over the next 3 months. Now, this is due to aid cuts if gaps are not plugged. Our Save the Children says this is putting severely malnourished children at risk of dying. And to tell us more, we are joined on the line by Yvonne Arunga, Save the Children's Regional Director for East and Southern Africa, based in Nairobi, Kenya. Yvonne, good afternoon, and thank you for joining us on Africa Update.
Good afternoon. Glad to join you this afternoon.
Now, Yvonne, Nigeria, Kenya, Somalia, and South Sudan are at least 4 countries that are expected to run out of the emergency food. Which other countries are we looking at?
Well, those are the most affected in the continent. But if we were to expand it, I would say, we are talking about malnutrition being witnessed also in Sudan. That's also under, civil conflict. We are witnessing also malnutrition cases in the north of Mozambique. And then in the countries that host refugees across Africa, such as Uganda and the refugee camps in the parts of Tanzania that borders Burundi, and as well as camps in Rwanda. Those are also hotspots for malnutrition.
Now, tell us more about the ready-to-use therapeutic food, that's the RUTF, and how it works.
So RUTF is a therapeutic nutrient-dense paste, right, made out of milk powder, sugar, oils. So it tries to deliver this very high energy, very high nutrient paste to children who are suffering malnutrition. And it's a product that doesn't need refrigeration. So it can be transported to the very hardest to reach areas where children are suffering severe acute malnutrition. And with this, it's both food and treatment. Of course, it's both food and medicine. And when children receive this, then the outcomes are very good.
Now, when we look at these countries and we say that these countries are to run out of food within the next 3 months, exactly at what deficit are we sitting in terms of the countries that are in crisis, for lack of a better word? And, with this RUTF, is this the answer to dealing with this crisis, and how long of a process will it take for this paste to be delivered in all these crisis-ridden countries?
Well, so just to put it in context, right? In Nigeria, 3.5 million children under 5 are severely malnutritioned. Yeah, with the highest needs in the conflict-affected areas in Nigeria, that is the northeast and the northwest. And in Kenya, it's 2.5 million who are currently under acute food insecurity. The RUTF stocks in Kenya ran out in October and are at less than 70% of what's needed. In Nigeria, likewise, less than 70% of what's needed during this season. In Somalia, we have 1.8 million children under 5 who are at risk of malnutrition. And 1 in 8 children in Somalia is suffering the most dangerous form of malnutrition, which I mentioned earlier. That is severe acute malnutrition. Mm-hmm. And in Somalia, we have less than 40% of the stocks of RUTF needed. Then coming down to the last of the 4 countries, which is South Sudan, we have 2.3 million children under 5 who are acutely malnourished, with only a third of the RUTF needed. So as you can see, we are in a perfect storm. So in other years, we usually would have had more than 80% of the RUTF stock needed to treat malnutrition children. But 2025 is an exceptional year. From the figures that I've just shared with you, you can see we are off what is needed.
What has changed? What is the difference between other years and 2025 for you to be sitting at such low levels?
Well, we are facing global aid cuts and funding collapses, right? So in past crises, donor funding was mobilized very quickly to fill nutrition gaps, but this time there's been severe cuts in the international aid mechanisms. So that means supplies of RUTF are running out. And then we have worsening supply chain pressures. The world at large is facing RUTF shortages. Manufacturers simply not able to keep up due to, again, funding in uncertainty, but also because of higher raw material costs. RUTF, like I'd said, is made out of peanuts, milk, powder, and oil. And there's no buffer stock this time round. And we're in a multiple crisis a situation in the humanitarian sector right now. So we're looking at in north and northeastern Nigeria, there's prolonged conflicts, there's climate shocks, we have economic downturns. So, and all these are hitting at the same time. Not to speak about droughts, floods that are destroying harvests and then displacing families across these countries. So that just makes the situation worse. As I speak right now, Africa accounts for 60% of the world's most food insecure populations.
What alternatives are there, or what alternatives can be put in place?
So, I mean, there's measures that can be put in place for the short term and then the longer term ones, right? So, malnutrition does not wait. Children need food right away. So, what we need in the short term is what makes access to RUTF possible. So, Save the Children has been running, outpatient programs, and together with the governments of these countries, I must say, to provide that immediate treatment for severe acute malnutrition children. But this needs resources, right? And it also needs, integrated, care, making sure, that staff are there, immunization, safe treatment, access to clean water. So there's a very real resource challenges in the short term. But for the medium and to the long term, it's all about, a call to action by our policymakers and those who supported in the past. So we are urging for financial support. We are wanting to raise funds that ensure that the access to RUTF, the supply chains of RUTF, are restored. And so we are also calling upon governments and institutions to fund flexibility, to fund the flexibility, of access to this and to prioritize this. So there's measures that need to be looked at right away to prevent immediate deaths of children. But then there's also things that have to be, put in place to ensure, that there's stability in the medium term, but also solutions for the long term.
Now, Yvonne, there's also been a number of closures of facilities in these countries. How has this further impacted the work that you as Save the Children have been doing?
Yeah, when there's closure to facilities, it just makes it even more worse, right? So you can imagine if you're a mother that has a malnutrition child and you have to access a facility. So playing in your mind is a very real risk that you will get there after a very long journey and find that the RUTF that you seek, the treatment that you seek for your child is not available. That's a real concern, as we've been discussing. But then now there's the added challenge that you actually make it to a treatment center or a stabilization center, and those have not been set up, like the temporary stabilization center. But if you make it also to, health centers, there might not be, the solutions that you seek, the access to RUTF or even to staff. So that makes a situation that's already critical, it makes it worse, much, much worse.
Yeah. Well, Yvonne, we have run out of time and are going to have to leave it there for today. Thank you for joining us on Africa Update.
Thank you very much.
That's Yvonne Arunga, Save the Children's Regional Director for East and Southern Africa, joining us on the line.
The KwaZulu-Natal Convention Bureau, in collaboration with Milvest Advisory and the city of Mhlathuze, brings you the 2025 Tourism Investment Forum, Africa. By positioning these regions for sustainable growth, TIFA helps drive